Good morning, everyone. I just wanted to start this session by thanking the team at Mass General for hosting this session for the AMG community today, as we kick off this series of educational sessions featuring specialists from the world-class institution that is Mass General. I'm so excited to be able to continue to build on this existing partnership and invite everyone from the AMG community to engage with Mass General in a way that makes sense for you and your families. So if there is a particular topic of interest to you or an area of health and wellness that you hope to learn more about, we're so fortunate to have the support of the Mass General community to support and broaden that education and provide unparalleled expertise in a multitude of fields. So I'm personally really excited today to be featuring a topic that so many people from the AMG community expressed interest in, and that is mental health. So I would be remiss if I didn't mention today marks 1 year since Sean Healy passed, following a 2-year battle with ALS, during which time he helped to build an incredible partnership between AMG and Mass General. I think that when AMG initiated this partnership with Mass General in 2018, following Sean's diagnosis, I don't think that anyone from AMG imagined the bridge we would build with the broader Mass General community. And it has led to so many great relationships that our AMG teammates have been able to cultivate with staff and leadership at Mass General. I know that Sean would be very proud of the work that has been done at the Healy and AMG Center, acknowledging the incredible research and the care of the team there to extend and improve the lives of other individuals and their families who are suffering from the terrible disease. In particular, I know that he'd be incredibly proud of the work that his personal friend, Dr. Merit Sikovich, Chief of Neurology at Mass General and the director of the Healy and AMG Center, has done this past year alone. So in light of extremely difficult circumstances, given the global pandemic, Dr. Sikovich and her team have made immense strides in research and care for those suffering from ALS, bringing Sean's vision for the center, which he shared with Dr. Sikovich, to light. So for now, I'm incredibly pleased that Dr. Sikovich is able to join us today, and it is my privilege to turn it over to her to introduce us to her colleague who will lead this session today.
Thank you, Caitlin, for organizing this and for your friendship and all that you've done for the center and for so many people living with neurological illnesses. I want to thank everyone for joining us today for this Mass General and AMG webinar series. We're eager to share our passion for helping others with you and hope that you come away from these sessions with news that you can use and other ideas for topics that we can cover here. Today's topic is resilience, something that we've all had tested across the many months of the pandemic. The isolation, the uncertainty, and loss have been kind of hallmarks of the past year. Though I hope we're at a crossroad of being behind that, but still there's a lot we can learn to help each other and ourselves. As Caitlin mentioned, this is compounded as we reach the 1-year anniversary of Sean Healy's death. I know this is a loss for all of you, and we still feel it really acutely. I want to say that each day at the Healy and AMG Center, he's there with us and his presence is there. And when we hear from patients, the hope that our center has provided here at Mass General, but also all over the United States and the world, and the options for them, I know that he is with us. And as he said, he'll be right next to us when we find the cures. So powering all through this can be exhausting, and finding ways to recharge and regroup can be challenging. So today, I'm just very proud to announce and share with you our guest speaker, Dr. Daphne Holt. She focuses on developing tools that enhance emotional resilience and reduce our risk for mental health illness. She's the director of the Resilience and Prevention Program and the Emotion and Social Neuroscience Laboratory, and co-director of the Schizophrenia Clinical and Research Program within the Mass General Psychiatry Department. She's also an associate professor of psychiatry at Harvard Medical School. Her research focuses on understanding the neural basis of emotional function and social behavior. She's brilliant. I'm really looking forward to her talk. Welcome, Daphne.
Thank you so much, Merritt, for those kind words. And it's really my pleasure to be here today to talk about this topic. I'm so excited that so many people have been interested in hearing about this. I'm just going to share my screen so I can show you my slides. Let's see here. Oops. Okay. Actually, let me just pause this for a sec. Okay. Sorry about that little technical issue. So I am going to talk a little bit now about the challenges to our mental health brought on by the COVID-19 pandemic, which we all we've all been affected by. And then what it means when we say that some people are resilient and what that is. What is this thing that everyone's talking about? What predicts it? How can we get it? And then I will describe some of the work that we're doing at MGH to enhance resilience. And I hope that I can leave you with a few ideas about things that you could do in your own lives that might help protect your mental health, or perhaps, help somebody that you know. So I'll just start by showing you some statistics that, probably confirms what you already have heard or know. The pandemic has had a huge impact on mental health. They're now more than 3 times the previous rate of anxiety and depression. So for example, in January of this year, 41% of US adults reported symptoms of anxiety and depression, compared to only 11% 2 years before. And this graph sort of breaks down people into age groups. So you can see here that in this darkest bar here, that actually this shows what people have talked about a lot, that young people, paradoxically, even though they're the least at risk for the illness, have been the most affected psychologically by the pandemic. And you can see some really alarming rates here of, a whopping 25% seriously considered suicide in the past 30 days. 75% of people in this age group have experienced some, behavioral health symptom. This data, even though what I'm showing you here was done in the US, there have been many studies conducted all over the world that have shown really remarkably similar results. And there have been many articles written about the fact that young people have been so affected. Especially, these are just images from 2 recent articles in the New York Times, but there are many studies and media reports about how young people and their parents have been particularly affected. But this is really not to say that people in other age groups are not affected as well. I mean, we know that people with caretaking responsibilities, parents, with young children who've had to homeschool, essential workers have also had really high rates of symptoms of anxiety, depression, other kinds of symptoms of distress. So here's an example of one person who we've worked with who's been struggling during the pandemic. And of course, her name has been changed and the details have been changed to protect her privacy. But she may be somebody who sounds familiar to you in terms of her general situation. So she is a married mom of 2 who before the pandemic was very engaged in volunteer activities in her community, kids' schools. She enjoyed hobbies like cycling, other outdoor activities. But during the pandemic, she rarely left home or her street. And even now, when things are improving,
Dr. Holt, I'm so sorry to jump in, but we can't see the slides that are the current slides.
Oh, I'm so sorry.
Oh, there it is.
Oh, wow. Okay. Oh my gosh. So Should I go back and show you the, oh my gosh. So these are the statistics that I was showing you, but maybe what I told you was sufficient to give you the picture. And then, yeah, so I'll just go on. Thanks for telling me. Sorry about that. So Sandra works as a nurse manager from home on most days, and she also oversees remote schooling of her kids between Zoom appointments with her patients and her staff. And then, you know, unfortunately, her marriage has really been under stress due to the kind of the lack of space, both physical and emotional. And she's developed problems sleeping, which has been very common during the pandemic, insomnia. She's gained some weight, also very common right now. She's felt socially isolated and really quite burnt out. You know, that is probably a story that may, you know, seem familiar to you, but, you know, before we blame the pandemic entirely for the mental health crisis that we're in right now, I think it's important for me to point out that there were alarm bells going off about our mental health before the pandemic. You can see evidence of that here in these kind of, you know, pretty clear trends, you know, of increasing numbers of mental health related visits to the emergency rooms, and, you know, the real tragedy of the increasing rates of suicide, which we also see particularly in young people. So overall, we as a society, we really need to think hard about ways of reversing this alarming trend. So many studies have been conducted during the pandemic to try and figure out what's helpful to people during a crisis like this one, to keep people from developing, you know, debilitating forms of these symptoms or, you know, real despair during really these very tough times. So people have been talking a lot about this category of traits called resilience. And studies have shown that these traits are protective of one's mental health. But what is this? It's kind of a nebulous term that people have been throwing around quite a lot. So one way to define it is that resilience is really the capacity to or process of bouncing back or adapting during or following stressful situations or crises. And you know, 30 to 50% is thought to be determined by genes. People think of it kind of as a trait that you're born with, but it turns out it really isn't. It's not fixed. It can change quite a bit over one's lifetime, and it also can change quite a bit from day to day. One thing also, though, it's really important for me to emphasize is that, of course, we're not saying that it means one should be resilient when a person is impacted by major loss or trauma or uncontrollable events. You know, the idea is not that one should be able to function entirely normally during such really, really challenging life events. The thing we want to try to avoid is long-lasting problems, long-lasting sort of persistent issues with one's mental health. So the paradox really is that we must really face and fully experience some of the difficulties, the distress of difficult events in order to be able to learn from them and move on to some extent. So this idea is kind of captured by this brief phrase that in my field people use a lot: what we resist persists. The main idea here is if we avoid feelings, they may actually cause problems for us down the road. But, you know, nobody wants to feel those feelings. And so that's something that, you know, is a skill that can be learned. So what are people talking about when they measure resilience? So, you know, it's not a perfectly operationalized term, but I'll just describe to you in a little more detail what's measured when people use these resilience scales. Like the Connors-Davidson resilience scale is one of the most commonly used scales. So it asks people to rate statements like, I'm able to handle unpleasant feelings like sadness, fear, and anger. So that was what we were just kind of talking about. I have a strong sense of purpose in life. And here are some of the other items. And then here's one: under pressure, I stay focused and think clearly. This one always reminds me of sort of great athletes and teams. One of my favorite athletes is Andre Agassi, who he made a kind of a huge career comeback after the mid-90s. I don't know if any of you are old enough to know about his time in the spotlight, but he had sort of been left for dead. And then he started just coming back in the late 90s, and he had this incredible match in the 1999 French Open final where he came back after being down 2 sets, and he came back to win. But I also want to be really clear that resilience is not another code word for a strategy to win or succeed. That's not what we're talking about here. It's something much more broad than that and less goal-oriented. It's really not about the outcome per se. It's about experiencing your life in a different way, and having more sort of emotional strength or stability during times of really, great challenge. So how can we increase our resilience in order to protect our mental health? Well, there are things that we can and cannot change that predict resilience. Obviously, we can't change our genes. And we also can't really change our childhoods, so if we had a difficult childhood that has sort of persistent effects on our sense of safety in the world, that's not something that's sort of easy to modify with just learning some techniques. But it is possible, we know, to change the way we perceive and experience the world, our patterns of thinking, and at the same time change the way our brains function. We can also improve our mental health and resilience by taking care of ourselves in many important ways that you may already be aware of. But I just want to mention these because they're really important as a starting point. Getting enough sleep turns out to be really critical. Enough physical activity. It doesn't have to be a huge amount, but 30 minutes 3 times a week, something like that. And then there's some other things here that people have shown: social support, having fun, a sense of purpose. But the thing I'm going to spend the rest of my time talking about to you are the ways we think about ourselves and our world. That there's certain ways that we can sort of shift this, which can be learned with practice, that can really help our resilience. I mean, these are ways of thinking that unfortunately our minds are not actually programmed to use. And so they do take some practice, and do require learning for most people. So we have a program at Mass General called the Resilience and Prevention Program, which you heard about, in which we teach these skills to different populations. We have different courses and workshops that are tailored to adolescents, college students, healthcare workers more recently. But I want to emphasize that these skills are really universally beneficial and can be learned by anyone. So our workshops tend to be about 4 to 8 sessions long. And the idea is to shift this balance here between resilience and vulnerability. That's our sort of central goal. So what we focus on for the most part in these workshops are 3 evidence-based skills. And when I say evidence-based, I mean that these skills have been shown by lots of studies to be protective of people's mental health. So mindfulness practice, which you've probably heard a lot about before, self-compassion or compassion practice, and mentalization. So maybe you've heard of these, maybe you haven't. I'm just going to very briefly describe each one of these. So mindfulness is something that has kind of permeated the culture at this point. And so everyone's heard of it, but not everyone knows exactly what it is, because it's not actually like just being more relaxed or more sort of, calm or something. I think some people think that. Mindfulness is actually paying close attention to the experiences of the present, of what's happening inside you, the external world, feelings, thoughts without judging or avoiding these experiences. And so, this sounds very simple. But the reality is that we spend most of our times not doing this. We spend most of our times in our heads thinking about the future, thinking about the past, worrying about what somebody said or what I need to do today. And so this is something that actually takes some conscious practice to shift, to do a little bit more of this. And it's been shown that if you do a little more, spend more of your day in a kind of mindfulness state, it actually improves resilience and mental health. It actually also improves brain health. So there have been a number of studies that have shown that, and this is an image, an MRI image, it's a sort of high field, very high resolution image of the human hippocampus. So this is a part of the brain that's important for memory and also emotional function. And it's just there to remind me that there have been quite a few studies that have shown that mindfulness improves the function of the hippocampus and also actually increases its size, makes it sort of healthier structurally. And some studies have even shown that mindfulness practice counteracts or reverses the effects of aging on the brain. So one thing that's really important to realize is that mindfulness practice doesn't have to be done in a certain way. I think some people feel like I need to really practice it the way that, strict practitioners do in the lotus position, a certain amount of time a day. But in reality, you don't have to have a quiet place to do it. You don't need to sit a certain way. You can actually do it during your everyday activities while you're eating, driving, brushing your teeth, washing your hands. Or when you've noticed that you're kind of stuck in a kind of sequence of thoughts or worries about the future or the past, if you can do even a little bit to kind of step back, from your kind of go kind of routine in your day or that sort of cycle of thinking, you're contributing just that much to your mental health. Self-compassion practice is something that is becoming increasingly popular, especially among young people who tend to be often so self-critical and compare themselves to other people so much through social media. So self-compassion is also, like mindfulness, originated in Eastern religious traditions. And it's focused on learning to be kinder to yourself during times when you might normally be quite, critical or hard on yourself. So the idea is that during times when you've made a mistake or you feel like you failed in some way, you can try to, instead of beating yourself up, try to treat yourself like you would treat a friend in the same situation. So, it seems it's just kind of a little mental trick in a certain way, but it's actually, again, really hard to do and requires practice to do. And it turns out that this very simple practice has really amazing benefits in terms of mood, resilience, and the way that the nervous system and, the brain functions during times of stress. And the idea then is that greater compassion for ourselves is a prerequisite for having greater compassion for others, which then can lead to an increased sense of connectedness, socially sort of feeling more connected to other people, which turns out to be very protective against the development of mental health problems. And there's some things that make it really hard for some people to do this practice. So I'll just mention this because I think kind of hard driving, high achieving people in particular have trouble. And perhaps at AMG, you might think, no way, this is not something that would work for me because I actually need self-criticism to drive me to do my work, to succeed. And I'll let myself off the hook and it will make me selfish. But it turns out that all these fears that people have about, that it's going to make people think they'll stop working. And it turns out that the opposite is actually true, that people are more efficient and productive because they're not spending as much energy on self-critical thoughts or feelings of guilt and shame. They're better able to bounce back from mistakes and move forward. So this is just a brief clip of a nurse we worked with who is going to talk about using self-compassion in her life. I hope there may be some syncing issues with the audio and the video, hopefully not, but if that happens, hopefully you can still hear what she's saying.
The thing I've probably been hardest on myself lately is not being a present parent because I'm so stressed out. So when my kid wants to sit down and do Legos with me and I'm irritated that she keeps saying mom because I'm trying to check the news on my phone, and then my mind will drift to what's going to happen to my family if something happens to me, that I can't even be present. So here I am worried about not having my family, but then when I'm with my family, I can't enjoy them because I'm so nervous about what's going on. So being hard on myself and not being able to just appreciate what I have right now, that's difficult for me. And I absolutely know that a good friend or even God would be like, you're doing the best you can, These are really hard times and you're doing the best you can.
Yeah, so the third tool and one of the most popular components of the program is mentalization. So mentalization is the ability to think flexibly about the intentions of other people, to imagine a number of possibilities about what others might be feeling or thinking when they do certain things. And it really helps people understand that, better how to handle uncertainty, which is something that our brains really don't handle well naturally. We really have a lot of trouble with uncertainty. So I've included this image here because it's taken from a test that's often used to measure people's mentalization ability, and I'm hoping it sort of illustrates this idea to you. In this test, you need to figure out which emotion the person is likely feeling in this picture using only information from the person's eyes. And of course, this is something that maybe you've gotten quite good at during the pandemic, since you've had so much practice seeing only people's eyes over their masks. So see if you can do it in this example. So you were right if you picked playful. So again, as I said, uncertainty is really a challenging thing for the mind. And so mentalization is one of the tools we can use when we're faced with uncertainty, when we don't know what another person intends or is thinking about, and we have no way of knowing. And so often in a moment of uncertainty, we may jump to conclusions. We may sort of think of the worst possible outcome, catastrophize. We may think that we can read another person's mind, but really the goal is to think flexibly and consider a range of possibilities when imagining the future, the motives of others, and really any experience that's associated with limited data from which you can draw any conclusions. So I'm just going to now tell you about a little bit of data, because I know that one of the most important questions is, do these kinds of courses or these kinds of training programs actually work? And so we've done a number of studies that have shown us that it does. These things, I mean, just to get to the bottom line, they do actually increase resilience and decrease symptoms. So you can see here, this is data from a randomized controlled trial where you can see the people who received the training had improvements in resilience, decreases in symptoms of depression, decreases in anxiety, while the other group that didn't receive the training didn't experience those benefits. And these effects were still present 6 months later. And what was really interesting to us, especially, to me as a neuroscientist, is that we found that a certain pathway of the brain that we know is involved in the regulation of emotions, this pathway here, actually became stronger following this program, our resilience training course. So the people who received the course showed greater connections between these regions, which is really helpful for regulation of emotion, which then is very important for resilience. So that was an exciting result. And then we did a study in healthcare workers more recently, frontline workers, who took a very brief version of our course, just an online course that they did on their own. And we found, even with this kind of very short course, that the healthcare workers who took the course had significant increases in resilience and decreases in symptoms. And then I'll just mention quickly that right now we have really been excited about all the kind of developments in digital methods for delivering this kind of information, because we can really then make it available to so many more people. So of course we've adapted our program to Zoom, and now we have a new program where we actually deliver the training in virtual reality. So in this version of the program, people are given a headset, it's mailed to them, and then everyone enters this kind of virtual room. So we have one that's, sort of designed for college students and healthcare workers. And essentially people just meet in this room the way that they would in a real room. And we've found that this is incredibly sort of appealing to people and popular. And it has a number of advantages. So for example, some people really enjoy the anonymity of being in a VR group. You're there as an avatar. You don't have to use your real name with your avatar, and that can really help people get over the sort of barriers they feel, the discomfort they feel in engaging in some kind of something to support their mental health. And then VR really has a much greater, gives you a greater sense of connected sort of togetherness, like physical togetherness, because this is an immersive VR experience where you really feel that you're with other people. So it's kind of a little bit better than Zoom in that sense, in terms of feeling like you're actually with other people. And then it's really kind of a creative approach, in the sense that there are many sort of innovative ways that we can teach these skills that we couldn't do before, different ways to expose people to things that you wouldn't be able to do in real life. For example, so some people right now, you can imagine, are still, even with the lifting of restrictions in many countries, are still really uncomfortable being near other people. And we have actually done some research showing that people are really standing very much further away from people still, understandably, after a year of social distancing. But I think there's going to be a segment of the population that's not really ready. It's not going to be ready for a while to be close to other people. But through VR, we can really help people address those fears in a way that's sort of safe and acceptable to them. So just to summarize, just to get sort of conclude here, and give you a kind of general picture of the direction that we, and perhaps even the field is headed in. When we think about using resilience and trying to prevent mental health problems, when we think about someone, say, who is having kind of waxing and waning symptoms like you normally would in a day, but this person may be feeling more anxious on some days and not on others, may be vulnerable to developing a more persistent problem, maybe not. But in some cases, when a really stressful event occurs, sometimes a more persistent problem, a more kind of enduring illness develops. And this is something that we would love to be able to avoid. So if we could identify people who are vulnerable during this pre-illness period and give them tools, that would increase their resilience so they have a better outcome when something really stressful happens, that would really be a game changer. And so I think our big question now is, can we develop a kind of a resilience enhancing vaccine for mental health, that can prevent persistent mental health problems? So I just want to leave you with some of the things that I mentioned today. And I want to emphasize one thing I may not have mentioned, in that, one really important key to resilience is to remember that everyone is different. So think about, one really needs to self-reflect and think about what helps me be resilient. Some people need to be alone. They need time in nature. Some people really need to connect with others. You know, some people love to exercise, some people don't. There's no one right way to do it. So self-knowledge is really important. And then, as I mentioned, self-care is kind of like a basic first step to enhancing resilience. Getting enough sleep is really critical, it turns out. And then these tools that I mentioned, mindfulness, thinking flexibly, which, you know, is something that sounds good, but sometimes is really hard to learn on your own by yourself. It's nice to have somebody kind of challenge some of the conclusions that you're drawing about the limited information you have. And then self-compassion is something that I think all needs a little bit of, like you know, Diana, the nurse that I showed you during tough times. But sometimes it just doesn't come naturally to give us that ourselves that kind of break. And so it can be something that we need to learn. So I'll just end with this quote from Little Women. I'm not afraid of storms, for I'm learning how to sail my ship. Because I just want to emphasize that this type of work is really an individual learning process and we, you know, our program and others, I mean, we just hope to guide people in their particular individual process and their own journey towards better mental health. So thanks so much for listening, and I look forward to some Q&A, some discussion.
Great, thank you so much, Dr. Holt. We do have a couple of questions that have already started to come in. So we want to be sensitive to your time, of course, and hopefully we can fit most of these in. The first one is asking if you can maybe explain a little bit more in detail about how your workshops or your courses work and how people get into them.
Sure, yes. So our courses are, they are offered to people who are experiencing very mild sort of struggles, you know, mild anxiety or a little bit of depression, what we call subsyndromal symptoms, meaning that they are not struggling so much that they, you know, need immediate treatment. And so if people are having those kinds of symptoms, then we invite them to join a group of people. And so it's like a group workshop. And then in the workshop, people talk a little bit about their own experiences, but mostly there's a lot of didactics and then exercises, and then there's homework in between, but, you know, not like difficult homework, but practicing these skills in between. You know, these workshops are not very long. You know, we've had some that are 4 sessions. Now we have some that are 6 or 8. You know, it's not something that you have to do for months and months. And it's kind of amazing how just a little bit of exposure to this kind of information can sometimes be very transformative for people. It can really make a big difference. And sometimes it may not make a difference for a long period. And so there's like a, you know, iterative thing where people can, you know, receive more training, but it's nice to have people have a general kind of start. And more recently, we've been making these kinds of workshops more available, more universally. You know, there's universal kind of prevention where you basically say everyone needs these skills, whether you're struggling or not. And that's something we'd really like to move towards.
Great. The next question would be, as a manager, what do you feel is the best approach to help employees develop resilience?
Yes, well, you know, I think obviously I think from what you've seen is that I think that, you know, providing some mechanism for education about these things, you know, that, you know, whether it be an online course or, you know, some kind of exposure to this information, and, you know, sort of making it acceptable, you know, to engage in this kind of education and that sort of thing, I think is a really good first step. And then, you know, I think in general, creating an environment in the workplace that kind of reduces stigma, that essentially makes it more acceptable to talk about this kind of thing, for, you know, people to seek help, you know, when they're struggling, you know, with the idea that when people feel supported in this way, it often actually increases their quality of life, their work satisfaction, and in the end also makes them often more productive. So I think having keeping an eye on the culture, I think, is really important.
Great. So you just mentioned stigma. Do you think that given the pandemic, have people's attitudes about mental health changed? And do you think that stigma is still a problem?
Yes, no, it's funny. People have been talking a lot about this right now just because there have been so many celebrities who have come out talking about their own mental health struggles. And, the young people are really much less affected by stigma. That's been my experience, that there is like a real generational change in that talking about mental health in, kids in college, high school is much more acceptable. But stigma is definitely still with us. Let's not kid ourselves. And so I think there's still a lot of things that we need to do to keep that work, moving forward. And we also need to make sure that this increased kind of awareness and sense of compassion for people who are struggling with mental health issues isn't just like a blip, that goes away once, the pandemic is gone. And, we just have to keep that moving forward so that there's real concrete change in our culture about these things.
Great, thank you. Another question is, if someone is struggling with mental health and they tend to hit a wall with their primary care or their current therapist, what do you recommend as next steps from there?
Yeah, well, that's a tough thing, because in some environments, mental health treatment is not very accessible, and it's really a struggle. I think there's a lot that we need to do in terms of policy change to make mental health supports more available to people. But if I knew the particular situation, I would have some specific advice. But I would say that two things I would say is being persistent is really important. Maybe that's obvious, but there are lots of different avenues for getting mental health care, and then being open to different things that you might not have thought of. So sort of thinking outside the box in terms of what you'd be willing to do. So for example, one way that I sometimes tell people to try to get some treatment is through research studies, because a lot of research studies on new innovative interventions for mental health issues guarantee finding people kind of sustain treatment afterwards. Also, some of these new treatments are not very different from what we already have, and people don't usually have a true placebo group. So research is a good way to go. And then I think, there are all these things that are available in the digital universe, right? Online treatments, there are apps, there are things like that sometimes can be helpful, and they're just much more available. And then the last thing I would say is that, trainees, there's so many training programs with really outstanding trainees who are sometimes just incredibly passionate and, dedicated clinicians. And so you may not be able to see very easily like the biggest expert in the area that you want attention in, but there may be just a wonderful trainee who could actually spend a lot more time focused on what's happening with you. So those are some ideas, but I realize that it can be tough.
Yeah. One of the things that a couple of our teammates reached out about is how difficult this year has been, particularly for parents of children of any age, both for the parents and for the children. So do you have any recommendations for what people can do to take the best care of their kids in a post-COVID world as we come out of this pandemic?
Yes, no, I think this is going to be something that people are going to be talking about and thinking about a lot. And we have a program that's dedicated to adolescents, where we also have a parent component. And actually the parent component has been the most popular thing that we've done. And it's actually pretty brief, and it's just, people are just hungry for this sort of information. I have a daughter who's she's 8 years old, and she has struggled with the pandemic. And so I can very much relate this. I mean, what I would say is that, really obviously listening to your child, sometimes it can be really hard to listen to a child when they're struggling. Like it's a lot to hear when your child is suffering. And so being able to hear what your child is saying when they're not happy, instead of, stop whining kind of thing. Because sometimes children express distress in ways that are not direct. They're not going to say, oh, I'm depressed or I'm anxious. And so paying attention to that. One thing I think is really important for parents to think about is taking care of yourself. It's the whole, in the airplane kind of idea, modeling for your children how to take care of your own mental health. That's how children learn to take care of their mental health, is to see how their parents do it. When you have difficulties, do you stop and take care of yourself? Can you talk about these things? Can you normalize that it's okay, to be, under stress? And then I think one of the most important things, obviously, is if something is really awry, then it's important to get help. Like if there's some behavioral changes or, things that are unusual happening. Is there bullying? Is there, some real, like, more serious things? It's important to do something as quickly as you can, given sometimes it's not easy to get treatment quickly, but to sort of keep your eye out, I guess, for those things.
That's great. Thank you so much. I think given the time, we'll end with one final question, which is a bit broader. And a few people were curious, what is your vision for the program in the future and the future of prevention work in psychiatry more generally?
Oh, wow. Well, we only have a few minutes. I have like lots to say about that. Yeah. Anyway, yes. Well, I really think that psychiatry is at a crossroads in terms of this, and that, every other area of medicine pretty much has really focused on prevention for decades. And it's really been the most kind of, effective. It's kind of revolutionized medicine. It's increased people's life expectancy in all these different ways. I mean, when you think about all the major advances in terms of cancer prevention, cardiovascular disease prevention, infectious disease prevention with vaccines, psychiatry has not done this. But I think we can do it because we know there's been lots of research that has shown that we can prevent things like depression, anxiety, if we intervene early. But these things just haven't been scaled, to the extent that they should. And so I think there are all kinds of ways where these kinds of interventions could be introduced into society. And prevention obviously has to be done in a way that's where it's very accessible to people, like in the schools and primary care, online. But I think that we can do this, and I think it will have enormous benefits, either offering things to everyone that's kind of like universal prevention, or to sort of target people with risk factors, that's selective prevention. And then people who are really struggling, beginning to have symptoms, that's indicated prevention. So there are these 3 tiers of prevention that we can start to actually implement. And then my dream, because I am a neuroscientist, is that we also, sort of get to where the rest of medicine is and use objective markers for illness. So use markers of people's brain function rather than just what they're telling us, which, what people are telling us is obviously valuable. But the thing about disorders that affect the function of your brain is that what you say is actually not always going to be all that accurate, because your judgment might be affected. So it's really important, kind of more important than in almost any other field, for us to come up with objective markers of risk and target those people. So yeah, so thanks so much for having me in this series. And I'm happy to answer questions offline if people have additional questions. my email, I'm sure, is available, and I think I put our website in one of our slides. So so feel free to contact me, and have a great rest of the day.
No, thank you so much. And on behalf of everyone from AMG, I just want to extend our thanks to you, Dr. Holt, and to Dr. Sokovich for taking the time to join us today, and to the broader Mass General community for hosting AMG for this session. As Dr. Holt said, for any questions that we didn't have time to get to today, I'm happy to follow up with the attendees if they'd like to reach out directly, and she can follow up with you with written responses for anyone in the group that attended today. As a reminder to anyone from AMG, if there are other areas of interest as they relate to health and wellness that you would be interested in learning more about, please feel free to reach out to me or to the Sustainability Committee so that we can work collaboratively with our partners at MGH to find a way to include those topics in future sessions. So we're really looking forward to the next event, and thank you again, Dr. Holt and Dr. Sokovich, for hosting.
Thank you. Thank you.